First of all, I'll introduce myself again. I'm Quinton Lucas, the mayor of Kansas City, Missouri. As we all know, we are under a stay-at-home order through May the 15th. That order will remain in effect. We have a few more details to tell you about how we will handle our reopening, the types of activities that will be allowed both after the 15th, and several activities that will be allowed before. The first thing that I want to emphasize is that here in Kansas City, Missouri, we will always base our decisions on public health advice, public health recommendations, and frankly, doing the research that's necessary before we choose to act. And so those are the steps that we have taken already for greater than a week, perhaps even 2 weeks. We've been working with our health department. I know the health department has talked to hospitals, officials both in Kansas City, throughout the metropolitan area, throughout our entire region, to make sure that we're looking at good guidelines that tell people where we're going, but importantly also address the very clear and the very important public health concern. In addition to our conversations about data, we like to look at the trends that exist. And one trend that has been important for us in Kansas City, Missouri is the following: that week over week, our number of new infections have declined since the week of April 6th. That's the number of new infections. The week of April 6th, we had roughly 146. The week of April 13th, we had 101. The week of April 20th, we had 74. And this week, thus far, we have 36. If you look at the trend, that would get us to about 72 again. What we see is that there is a decline in that new infection rate. And by the way, let me just say this here and say it importantly for all of us. That is the result of the important steps that people in Kansas City have taken in connection with the stay-at-home orders. It isn't because of some randomness, it isn't because we're special, it isn't because of anything other than the fact that all of the important steps that we have taken over the last 6 weeks have led to fewer infections, have led to fewer hospitalizations, and have saved lives. And Kansas Citians are to be commended on that. Frankly, Dr. Archer is to be commended, and anyone who took steps to make sure our public was staying healthy and safe should be thanked in connection with that. So that's what we talk about when we say data. And I'm also proud of the fact that as we come to these conversations, they are not guided by what is the latest political trend, what is the latest rumor, what is the latest activity. Instead, they are guided fundamentally by how much do we need to do to make sure Kansas Cityans stay safe. We understand there is an important balance between our economy, right, and our health. But you can't have a good economy, you don't have customers, you don't have workers if people aren't healthy, if people don't feel safe. So let's talk about what we are announcing today. In front of me, you'll see a description of our 10-10-10 program. What that means is that effective May 15th, businesses, all businesses, will be able to reopen, including those non-essential businesses that have not been open previously, subject to a capacity rule of 10%, or for their smaller establishments, 10 persons in the establishment itself. And then the final 10 is to the extent that you have someone, a customer who is seated for more than 10 minutes, businesses need to keep track of those people who come in. It can be done through reservations for a restaurant. It can be done through a list of everybody signing in at a church. We'd ask that you not sign the same sheet, so perhaps have someone verbally who jots down all of that. But the point is very clear in connection with that. Our goal isn't actually to see what everybody's doing, to be Big Brother. More of our goal and our emphasis on that is to make sure that if there is an outbreak at a beauty shop, at a barber shop, at a church, that our trackers can actually track down everyone, that we can know where an outbreak is, we can address it quickly. I'm proud of that. I think that was innovative. This is an idea that Dr. Archer has had from the beginning of this crisis, and this is something that will help us as we enhance our tracing investments. Another step of our strategies will be to give specific rules in a number of different industries. Restaurants, bars, gyms, museums, any types of entities where there are lots of folks that may come in, lots of folks that come out, and where we think it's important to have extra guidelines, we're going to work over the next 2 weeks to make sure that we have clear and specific guidance for them. You have heard me talk about a few other jurisdictions, including the state in which I live, Missouri. One of my concerns is that when we try to just flip the switch, right, we change too drastically and we allow for a rapid increase in infections by just opening up without responsibility. I think what we have here is a responsible acceleration, right? We're putting our foot on the gas, but we're not doing it all the way. We're saying it's important for us to reopen, but we're going to be smart with how we do it. As part of our SMART process and how we open or how we reopen, we also are having what we call a soft reopening, a soft opening. What that includes is the fact that there will be a number of businesses that are allowed to reopen prior to our May 15th date, and indeed that can open 1 week from now. Those businesses are those that were previously classified as non-essential businesses, but that do not regularly have the public enter. For example, let's say you have an advertising firm, right? If you have that firm, right, you largely don't have the public coming in every day. You may not have a high number of customers. There is not that foot traffic or that volume. And so our requirement there would be simply that they maintain social distancing, right? That advertising firm, that office, so many other entities that in our conversations with Dr. Archer could be open now. So to make it a little clearer, I'll note this, and I'll go back to some of our old guidelines that existed previously. Essential businesses are, for example, hospitals. Hospitals can do anything that they actually want right now, right? At present, a hospital could have an elective procedure. You could go in for a checkup. You could do anything of that sort. I know there are some people this week who have said, what about furloughs at hospitals, any number of things. We, our health department, our city, has not at any point curtailed their ability to have any number of activities, and in fact, I would encourage them to, as we open up, look to include those broader healthcare needs that our community will need long term. That's one area. Our next area are non-essential businesses that are closed to the public. Those businesses will be allowed to open again in 1 week. Why 1 week? We wanted to make sure, and we think it's vital, and frankly I think this is the difference between how you might have seen things done in our suburban Missouri counties and certainly how you're seeing things done in Kansas. We think it's important that businesses have some advance notice. That's why we're having a press conference now to talk to you about things that happen not just next week, but happen on May 15th. You shouldn't give folks 4 days of notice. You shouldn't give folks anything, I think, less than a week. And so that's why we are making clear to those businesses that were listed previously as non-essential but not open to the public, your factories, anything of the sort, that not only can people come back to work in a week, but we encourage you to come up with important rules that will keep people safe. As part of that, we are adding to my order today a requirement that every business that is allowed to reopen, so every business that's in the non-essential business category, must allow workers to continue to work from home or allow workers who feel uncomfortable to not come to work, okay? So any business, right, that is being reopened subject to this order prior to May 15th must allow workers to continue to work from home or cannot terminate or penalize those persons for not coming to work. The reason we're doing this is fairly clear. There are a number of people who may be immunocompromised. There are people that may be in subject groups, like those persons over the age of 60. Or frankly, there may be persons who live with loved ones, older persons, or feel unsafe going out right now. Every day, I get communications from people who say, I'm not ready to go out, I don't feel safe for my family. Kansas City is going to protect those people. And so what we are doing is saying that if a business opens early pursuant to our soft opening rules, then for at least the period between May 6th and May 15th, no one actually has to come back to work earlier than they are ready. That's something to protect employees. Frankly, I think that helps protect public health. We shouldn't be forcing people really ever again, but certainly not now, to actually have to go back out even earlier. A few other things I want to note, and then I'll be ready to stand for questions. The area of businesses that you may be wondering, and these are just an example of those that will not open until May the 15th, include bars, restaurants, government facilities to the public, our zoo, dog parks, community centers, museums. The reason for that separation of industries is this: because we want to make sure that where there is a business, where there's an entity that's an attractive nuisance in a way for the public, that brings in lots of people, we have to make sure we have safeguards in place to protect everyone who's coming in. A group of businesses that will be allowed to return to being open are, for example, salons, barber shops, etc. The reason for that is this: because in connection with the guidance we're receiving today, we'll also be providing guidance to those facilities as to how they can protect their customers and actually the workers themselves. That will include a requirement that all those who are working at those facilities wear gloves, all those who are working at those facilities wear masks. That requirement would also include that all of those who are patrons wear gloves and masks at all times and to the fullest extent possible. And so those businesses, while they are allowed to open again, will open in a changed manner. I hope you see that as we've gone through all of these orders, our goal is to provide clear guidance, but our goal is to also make sure as we provide that guidance that we are making it certain to folks that you can't just reopen with a list of recommendations or with a list of rules that aren't actually tied to real public health needs and real public health concerns. I also hope we've made it clear that we will continue to protect every Kansas Citian. And what I say here is this, and I think it's an important thing. We still encourage everyone to stay home as much as possible. We still encourage everyone who can telework to do so, at least through the period of May 15th. We'll come back and talk to you afterwards about whether we'll look to extend that even further. We also, in connection with event sizes, are maintaining our rules and controls as for events. That includes a ban on events over 10 people for those inside. For events that are outside, you may get up to 50 persons, but social distancing must be maintained. Today, what we have announced includes our churches, and that includes any other entities that we haven't really specifically announced thus far. We think that this is a smart way to move. We think it's a responsible way to move. It shows that we are listening certainly to those who talk about businesses, but more than anything, and always, we will listen to our health experts. Our health experts will be guides every step of the way. One other thing that I will be announcing today, or I guess I'll announce to you right now, is that we're going to extend our state of emergency for 90 days. What that means, and the reason for that, is because we will continue to need to look to how we will escalate our event restrictions ongoing. Right now, we will have a 10-person event guide. I would hope that in several weeks we're able to go to 25 persons. I would hope shortly thereafter, probably in the early June time frame, perhaps we can get to 50, and hopefully by the middle of the summer we're at much larger events. But I say I hope, because it's based on data, it's based on facts, it's based on the recommendations from Dr. Archer. So I have people who call me sometimes and say, Mayor Lucas, I'm getting married in 3 weeks. Should I plan to have my wedding here in Kansas City? If it's a small one, perhaps. If it's not, then I would look further out. But all of those standards will be based on medical data, they'll be based on guidelines, and they won't just be based on either my policy preferences or anyone else's. And so that's where we're going in connection with our orders for the future. I think with that, I will open for questions after I make this one final point. People often ask, what is the data that you use? What is it that you rely on? It's very simple. I read that Kansas City, Missouri number of infections. We continue to look at hospitalizations. We continue to look at testing and tracing. And let me focus on those two categories because they are incredibly important. We cannot say that we have a proper approach to how we address COVID-19 if we don't have a strong approach to how we are tracing people. That's why we have the requirement for if you stay somewhere and you're seated for 10 minutes, your business has to keep track of that person. The reason being because we want to make sure that we are doing that good tracing to help track down any future outbreak. And on testing, we continue to work hard to ensure that we have more testing in Kansas City. Kansas City, Missouri has led the region in a number of different ways throughout this crisis, and I want to commend Dr. Archer and our health department for the fact that they have allowed for broad-based testing, not enough, but broad-based testing for folks who may also be asymptomatic. And on May 1st, we're expecting to get results of up to 500 tests. What those results will tell us is how well things are working, how things are not working, and will help give us guidance even further for that which we can do in terms of how we plan out our next phases. Kansas City City Council last week invested $800,000 in more testing and more tracing, including having more employees that can handle tracing. Those steps are going to be vital for how we address these issues long term. And we will need to continue to invest in testing, tracing, and watching hospitalizations. But importantly, it is not just the number you saw yesterday from the governor. Right? It talked about the percentage hospitalizations and them being down. A big part of that is the fact that A, we've been successful with our stay-at-home orders, but B, we haven't had as many elective procedures, right? We haven't had some of the same operation that we have as normal. As we reopen, we need to continue to pay attention to what our hospital capacity looks like. We need to continue to listen to doctors, not politicians, and we need to continue to always rely on sound and important medical advice. I'm actually, before I speak, going to bring up Dr. Archer if you wanted to say anything for a few moments, and then I'll come back for questions.
Anybody that's listening today knows that this virus hasn't gone away. It's still going to be present in every state. So as we ease these restrictions, if we don't have the capacity to quickly put out that outbreak, that fire, then we'll be back to very draconian measures, whether it be at a state level, a city level, or across the whole country. So this is a very carefully titrated process. We learned from the SARS outbreak in Toronto in 2003 that even after there were no cases in the first phase that they were aware of, so we were down to 0, 2 weeks later they had the second wave and had 2/3 as many deaths in the second wave than they had in the first wave. So all of us in public health know that we are opening this up at a point where it's going to be a problem and we're going to have outbreaks. That's why we're talking about having, wherever we can, the actual contact tracing data already collected. We want that to be maintained for 30 days so that if we find an outbreak, we can go back, get those folks tested, get them isolated, and keep that from spreading so that we don't have to go back as quickly or early in shutting down non-essential businesses, those types of things. So this is there to actually protect and open everything up. Having said that, I want to make it clear and reinforce what the mayor said. It is still not safe to go out, particularly if you are over 60 or you have any of the pre-existing conditions in regards to heart, lung, immune problems. If you have both those, and particularly if you're over 70, then I'm really advising you to still be extremely cautious. We think that all businesses, both to protect their own employees, but also to protect customers that may be coming. You've seen the old signs, no shoes, no shirt, no mask, no service. So we really are recommending folks to think carefully about this and require, at this stage, the mask for service, because if you do that, we can keep opening up and we can keep our economy going. All of this is critical for us to take the individual responsibility that we can, but where you control an event, you have an extra responsibility to the public. So thank you.
Dr. Archer,
Mike, we're gonna do it separately. I'm gonna start first. You go to Dr. Archer second. We're gonna go in order as well. Do you have a question?
I do. In regards to the undocumented community, how do you address the concerns in regards to just quote unquote harvesting name and information?
Understood.
To a business?
Understood. The question relates to, in connection with undocumented persons, how do we address concerns as it relates to kind of tracking folks and all those sorts of issues. I would imagine the only entity that would be seeking any type of information about who has been anywhere is public health. And much in the same way that public health releases data subject to the many rules that guide everything that they do, from testing to the spread of sexually transmitted diseases, any number of things where they often do maintain that amount of privacy is essential. We will do the same thing with this type of registry. This is the sort of thing that I won't be seeing. This is the sort of thing that others will not. This will just be the relevant health information. Any questions? So we're not, in terms of requiring masks, the mask and PPE requirements will apply to any businesses where social distancing cannot be maintained. Think about your barber shop, your beauty shop, your nail salon, where you were close to someone. And so masks and gloves. Frankly, I think, now we haven't finished our promulgations for restaurants yet, but it will be likely there. For all other businesses, we make a recommendation as to the wearing of masks gloves if necessary and essential. But nevertheless, where you cannot maintain that social distancing, then we would find it important, and we will have in the guidelines that masks are required and gloves are required. Expect that if you go to the beauty shop in 10 days, a week from now, that you will be wearing gloves and a mask, and that the person that is addressing your hair will be wearing gloves and masks. Yes, ma'am?
Can you talk a little bit about what the enforcement will look like? Will this require self-policing? Will public health officials be monitoring?
And I'm going to have John repeat everything.
Enforcement, public health officials going to be monitoring it, will there be policing?
So the question relates to public health officials enforcing these rules and monitoring. I think a big part of what we're trying to do is to actually see that we can monitor in the places where there is the highest risk. We recognize that where people are interacting closely, where there are crowds of different Kansas Cityans and others that are coming in each day, it will be most important for us to watch closely. And so in much the same way that we've already had the Health Department, the Department of Regulated Industries, our 311 Action Center being a part of that whole regime, making sure that we're doing enforcement, often call-based enforcement, we will look to do the same thing now. So for example, in connection with the part of our order that suggests that employees do not have to go back to work before May 15th if they feel uncomfortable, if your employer says that you are required to, and you work for a non-essential business, then I would encourage you to call 311 and say that there is non-compliance with that order. And depending upon the type of business, either the health department or regulated industries would likely address that issue. That is the sort of thing that we are looking to in connection with what our enforcement looks like. Where necessary, the Kansas City, Missouri Police Department has already worked with us with enforcement. We do not look to run around like some force that's trying to seem like we're trying to boss people, and so we're not going to have officers showing up to every business in Kansas City. But where an arm of Kansas City government has reached out to someone and said, we see that at your salon you're not providing masks and gloves, and folks continue to proceed, then we will take the steps necessary to both address that business with fines and where necessary to close that business. This is something that's already happened while we've had our stay-at-home order, and it's something that will continue to happen as time goes on. Mr. Mahoney?
A couple of questions there. Number one, are you comfortable this is going to be compatible with the other jurisdictions that are opening up earlier? Number two for you, Mayor, is where are movie theaters in this? And for Dr. Archer, the question is, where are we at in your mind in terms of an acceptable supply of tests? I know you would like to have a lot more, but an acceptable supply.
Okay. I'm going to answer mine, and I'll keep a note for you on Dr. Archer's, and we'll just switch because it makes better moving for our distancing. In terms of the impact of us versus other jurisdictions, and let me spend a moment and talk about our outreach to other jurisdictions. I don't know if there is anybody in this metropolitan area who has talked to more people from different jurisdictions over the last week than I have. I have regular calls with the governor of Missouri. I believe I talked to him yesterday. I, over the weekend, talked to the Jackson County Executive, the Chairman of the Johnson County Commission, the Mayor CEO of Wyandotte County in Kansas City, Kansas, County Commissioners in Jackson County, legislators in Jackson County, Commissioners in Clay and Platte counties. I do not talk to health directors in those areas because I believe we need to keep the politicians from the science and let the science actually drive our decisions. But in connection with all of those, I have consistently said I think it would be important for us to work together. I've consistently said that we have one region, we're one metropolitan area. One street in my city goes through a number of different jurisdictions. If you talk about the 152 corridor and you're looking at the city of Liberty in Kansas City, Missouri, right, there are lots of things where it would be important for us to coordinate. For whatever reasons, people don't always elect to do so. So I recognize that I think we're implementing rules that are, frankly, the best rules that we have right now in this entire metropolitan area. What I have said ever since we started to see the order dates moving was that what we cannot do and what we should not do is issue orders and guidance, one, where the public and business doesn't have enough time to properly plan, and two, where it seems like we're making recommendations that aren't based on either public health advice and aren't based on the fact that we're going to follow up our orders later. That's fun. I would say that I think our order, I'll just speak to Kansas City's order, and I've read everybody else's, so I'll answer it this way. I've read everybody else's order. I think our order successfully accomplishes that. And so my view is that's the way that we should be unveiling these sorts of things. That's why we're talking to you right now about businesses that still won't be open for, what, another 16 days? Because we need to make sure, I mean, I'm thinking about how businesses know how to operate right now. I'm thinking about the fact that there's somebody at a restaurant that we're going to be saying, have enough gloves so that they can be replaced during a waiter's shift, by the way, have enough protective equipment so people can regularly wear it, and make sure that you'll have new rules for the people that are coming in. That's not the sort of thing that you just say, hey, we'll give you guidance later. That's not the sort of thing where you just say, in 4 days, we'll figure it all out. And that is the problem with opening too soon. We're doing the work right now to make sure that when gyms are open, instead of just saying, yeah, you should wipe down and make sure things are clean, to actually find a way that the health department can give clear guidance and advice for everyone in connection with what that looks like. And that's why we are operating that way right now, and that's why I think that this is the best of the rules, and I would love, and I actually think it will be vital, right? This is a very close metropolitan area. A part of a district in Kansas City, every district of Kansas City borders another city, another jurisdiction. And so it's going to be vital for all of us to work with each other. But I will tell you this, right? Kansas City, Missouri government has done that. The health director has called other health directors and not received a return call for hours or days. I've called other people and sometimes not received a return call. I think that's not the sort of thing that actually helps us with regional cooperation. And my view would be that it's important for us to work together, not just when we all agree and there's a prevailing sentiment nationally that we need to do something. I think it's also important for us to work together when the politics get tougher. It's important to work together when perhaps people are saying that we are having concerns with what's happening right now. And I think that's why we're taking this step. You had another part of question one, which is, and I remember movie theaters, but I'm going to keep talking on impact. And you asked, do I think our order will have an impact on any other jurisdiction? Yes, for a few different reasons. First of all, 505,000 Kansas Cityans being healthier means that there is less threat to everybody anywhere in this region. And I'm proud of the advice that Dr. Archer gives us. I'm proud of the steps that we're taking in Kansas City. So yes, I think we'll have that clear public health impact, and I think that will help the entire region. Going the other way, other jurisdictions. I know there are some jurisdictions, particularly on the Kansas side, which are still deciding the steps they want to take going forward in terms of when their orders expire, what types of rules they apply. I hope they will look at some of the guidance that we've listed out today to see what might work in their own jurisdiction. I'm proud of the fact that even Platte County last night used one of the suggestions I think that we had made some days ago to one of their commissioners relating to having a list for better tracing. That's the sort of thing that we think is important and it's valuable, and so I think we'll have an impact. I don't know if I'm changing anybody. I don't know if Lafayette County is going to say, hey, we love what Lucas did. I would love it if they did. And I don't necessarily think that will happen. What I do think, however, is that with a step like this today, we'll make people safer. As for movie theaters, that would be subject to our 10-10-10 rule. And actually, I would imagine that they're just not open yet or allowed to open yet at this point. The reason being because we don't have proper protocols for how we can maintain, and it's not just social distancing, how you can make sure similar surfaces aren't touched, how you can make sure that we have the same cleaning. So I think much like gyms, we would continue to see movie theaters shuttered at least through May 15th, but I would imagine thereafter we'll still have issues with how we address movie theaters. Yes, sir. I'll get your question. Michael, I'm going to get him after I go through a cycle. So just catch a pen. All right, thank you.
We've seen today, the black and brown community
Yeah.
has been affected the most. I'm concerned, and people in the community are concerned that if we open up this state, Kansas and Missouri on May 4th, we're going to put brown and black people in danger.
Yep.
For the sake of dollars. How do you respond to that?
I respond to that by saying, and the question relates to the impact, the disproportionate impact we've seen on the black and brown community and what happens if we open up too soon, May 4th or thereafter. I agree with the critique. And you know what, let me be too honest. Sometimes my press people get on me and all that sort of stuff, but I will be too honest. I think that the ease with which the conversation changed on when we reopen and how we reopen directly relates to the fact that people aren't looking at the disproportionate impact on black and brown people in Kansas City and the disproportionate impact on black and brown people throughout our region. You know what? And maybe it's just because I've been black my whole life, but that's what it looks like to me. And how 2-3 weeks ago, we were all about fighting together to address COVID. We were going to solve these things. We were one. And I will add this criticism that we all stood there and did a press conference together versus now. You know, I don't know. We can draw our own conclusions. But I think my view is that, yes, there are some of us who are gravely concerned about the impact on the black and brown community. That's why every day I get hundreds of text messages from a bunch of people that are telling me, open up. And I say, yeah, I understand you want your restaurant open up, but what I'm not going to do is have another outbreak and have that outbreak continue to negatively impact communities of color disproportionately. And so, you know, everybody else makes their own choice in life, moves their own direction. What we will never stop doing in Kansas City is making sure that we are working for and looking out for the most vulnerable. And to those who will criticize some of our moves today, and I know there are many who will, who say, I want my restaurant open across the street from name your city, I'll say that this is what we're going to do and what we're going to make sure that we do, not just today, not just 4 weeks ago, but throughout this crisis.
Follow up to that.
Yes.
A lot of numbers on this on May 4th, May 15th, 90 days, 10, 10, 10. How do you and the city get across this to everyday average citizens of the proper protocol that you're laying out?
Yep. So a few different things. And one is, you know, the health department already, I think, has done a fine job of reaching out to most businesses in Kansas City. We're already starting our messaging, particularly in the businesses where people are in close proximity. We will plan to have extra outreach to your barbershops, your salons, that sort of thing, to make sure that they know. At a certain point, we will make sure that there is a regular set of inspections that happen thereafter. And again, I critiqued a little those that haven't given good advance notice. This is why you give advance notice, so that you can make sure people know this is coming down the line, this is why we're doing it, and frankly, we expect you all to comply. That's what we've done throughout this crisis. That's what we will continue to do throughout this crisis. Any questions from this side?
Yes. So I just want clarification on the 10-10-10 rule. This is for public businesses, right? Not private companies who don't have public inside, correct?
So this is for clarification as it relates to the 10-10 rule. To whom does it apply, private versus public? This is also for private firms that of any sort. So all these rules apply to private firms as well. And so if you are a private business, right, you have the public regularly come in. So a store, let's say you have a clothing store, for example, then you need to be at 10% capacity, right? And if someone is sitting down at your store for whatever reason, a fashion show, who knows, right, then you will need to have some tracking of who is coming through.
So, but for like a law firm, they don't have to follow 10-10-10.
A law firm?
They don't have public coming in.
Right.
And then also, the 10 people, I'm assuming does not include people who work there. That's 10 people in the public that come in, or 10% of the public?
No, the 10 include the people who work there as well. So the 10 actually include the people who work there as well. This is for again, the non-essential business open to the public. It's either 10 people or, importantly, 10% capacity, right? So there will be, for example, some entities that are much larger. Let's say you have a very large clothing store, right? That would probably be a situation where you're subject to the 10% capacity part of it. It's an or, so 10% capacity or 10 persons. And so in that situation, you would be subject to the capacity rule, but that applies to any private business, any business in Kansas City, Missouri.
So that's employees and customers.
Say that again, I'm sorry?
That includes employees and customers.
That includes employees and customers. All the persons present, because all the persons present can be part of the spread. And frankly, right, it's necessary that way. We want to make sure that in the event that there's an employee who themselves may be sick, we want to make sure that they're not spreading broadly to everyone else with whom they interact. And so that's where we are on that.
Okay, I've got a question for Dr. Argento that I can.
Okay. And then are there any more Mayor Lucas questions? I'll go here and then we'll go there and then I'll stop and get out of the way for the good doctor.
You briefly mentioned restaurants and you're kind of working on the plan for that. Do you know when you might have some more details as to restaurants and bars and when they should do? Or do they need to follow that gloves and masks type of thing?
So for restaurants, we will actually continue to promulgate even more guidance for them. We have in excess of 2 weeks to do so. I would think right now, if I were a restaurant owner in Kansas City, I would certainly plan to acquire a complement of gloves, of masks to be prepared for my own staff. And we will look to have even further guidance, certainly as both medical data throughout the country advises it, but also as we look to ratchet it up as well. On restaurants, bars, for example, we also will look to how can you maintain that distancing. In some ways, right, I know that in another of our counties, they suggested the 6-foot distancing. Well, the challenge is if you have 6 feet between tables, then actually people also sit at the tables, so you may end up with less, right? We'll be looking to something more akin to 10 feet of distance between those tables, right? Or finding some way that you could actually have space with people as time goes on. And of course, that will change as the data requires it. Right? As we see that we are in a somewhat safer place, we'll look to increase the percentage occupancy that's allowed, up to and including when we can get back to 100%. We also recognize that there are some restaurants and bars that have outdoor spaces. How we plan to treat those and address those will be something that we issue well before the 15th of May as well. Yes?
With the 90-day state of emergency extension, have you talked with the utility companies and the water department about utility shutoffs? How does that work?
So on the utility shutoff, we would, so the short answer is the state of emergency won't mean that we'll be under the same order the entire time. The state of emergency extension is more for us to be able to regulate large events. As you might have been able to notice, right, I disagree in some way with the governor's view the other day that large events can just start happening in Missouri again with adequate social distancing. I think it's fair to say that there will probably not be a Kansas City Royals baseball game at Kauffman Stadium in the month of May. And so as part of our necessity to be able to regulate large events, we have to continue to have that state of emergency, even though we're going to pull back the orders. However, to the extent that our orders are keeping people out of work, that's the sort of thing where we will continue to work with our utilities to make sure that there are not shutoffs during that period. I would imagine then that our utility shutoff time would continue to be through May 15th. I'll also note both this week at City Council and actually throughout this process, we continue to provide funding to support folks who are finding themselves subject to cutoffs. We have a Mid-America Assistance Coalition to help pay not just for our water utility cutoffs, but also to assist people with other utilities that are having trouble with their bills. We'll work with our courts in connection with evictions. We do plan that through May 15th, through the end of our existing stay-at-home order, we'll continue to make sure that we're not leaving people out there who are having trouble addressing any financial needs. Ms. Kite? Understood.
When will you move out of phase 1, and what does life look like as we
Yep.
go back?
All right, so when will we move out of phase 1? I hate to say it this way because it sounds cheeky, but we will move as the science, as the data, as the medical recommendations suggested. And so in connection with that, we will look after May 15th, which is our next point of assessment, to see, in essence, where we are. To see where we are with, remember those 3 things I had mentioned before, hospitalizations, testing, tracing, and of course we'll always look to new infections. If there is a rapid, unexplained spike in new infections, then that will let us know how either successful we're being or not. And so we will continue to look at that data. I can give you aspirational goals now, and these are my aspirational goals, which I shouldn't, but you know, it's between friends. Aspirational goal 1 will be that by midsummer, I'd like for us to return to events of some size, okay? And some size would mean events that probably exceed 100 persons, perhaps in the several hundreds, that sort of thing. By late summer, i.e. near the end of the order, August 15th, we would look to have even larger events potentially exist, perhaps even before that point. And so our goal is to actually, if we track in the way that we would like, to be able to have things like conferences, smaller level conferences, and other such things that might be able to return to Kansas City perhaps by the fall months. Again, we're not sure of that yet. It will always depend on the data, it'll depend on the science, but that's where we're trying to go in connection with this. Another thing that I think is important, and I've said this a few times, not just today, but before, Kansas City will always be driven by the data on hand. And so we will continue to focus on what is the data telling us. We're proud of the fact that we had, frankly, several weeks, now almost 4 weeks, of a sustained decline in new infections, because that actually relates to medical advice that says you want to have basically things aligned with incubation periods. 2-week incubation periods we've been able to see at least, right, for our 2 weeks and then double that, 4 weeks, that we're seeing at least some decline in new infections on average week to week, with daily spikes sometimes. That's the sort of data we want to rely on to help make informed choices. And the other thing I'll note is that it's going to take real patience. And it's already taken patience for us to sometimes withstand public scrutiny or any number of things that are saying you should just move now. We want to make sure not only that we're looking at the data today, but that we're tracking the data for weeks on end. On the second point of what does life look like hereafter, what does it look like in the months ahead, I would think that in a week, we have people that can now go out for non-essential activities. That will be a significant change for the community. But we have a world where there are more people that are wearing protective equipment, particularly when they're in close quarters. We'd like to get to a point where we're seeing even more people that are wearing protective equipment, i.e. masks, when they go to the grocery store. And we have a world where we are continuing to maintain that good guidance of social distancing. And we're continuing, I think importantly for employers, because I understand my orders will expire at some point. I hope that even after May 15th, if an employer hears from an employee that I don't feel comfortable coming in, I live with a relative who's immunocompromised, then they will still allow that person to work in some alternative way. I hope we will continue to allow teleworking opportunities. That's the sort of step that we need to take. And I will say, as a critique of local government, part of the reason this building is so tall, right, is that we require people to come in and do a lot of things. Get permits, get business licenses across the street, get liquor licenses. Well, now you can do that without coming in. We need to find more ways that allow people to not actually have to come into government to try to obtain any number of services. And so I think it's going to be a learning curve for all of us to try to make sure we address that. This will be my last question. Yes?
So these soft open, non-essential businesses that don't have public entry, that's beginning May 4th or May 6th?
Does the soft open begin May 4th or May 6th?
Soft opening 1 week from now, which is May 6th.
And then all of the same rules apply to them?
All the same rules apply to those businesses?
All the same rules apply. Yes. Any business, so the non-essential business that the public does not come into will be subject to social distancing guidelines, generally. They may be in a situation where they still have a higher capacity than 10%. For example, let's say a large factory. We would ask them to try to maintain social distancing. Another recommendation that we have is to permit more shifts where at all possible, so that you can have work completed at different times. Another thing that the city needs to work on is how, with our construction permitting process, do we allow more construction shifts at different times as well, right? If you have everybody forced to work within the same hours, let's say after 7 a.m. every day, then that might mean that, right, you're having more people into a confined space. If we allow more shifts, then that creates a better opportunity. That's the sort of work that we'll continue to do. That's all the questions that I'll take. Will remain for Dr. Archer.
So remember, the reason we haven't opened up before this is because even though at the end of December, we should have started funds from the feds coming down to the states to be prepared, it didn't happen. We have, unfortunately, a culture of outbreak response, but not a culture of outbreak preparedness. And if we don't set up systems to be able to move money rapidly from the federal, state to the local level, we're going to be in this again with every additional wave that we have of this outbreak over the next 2 years. So on the issue of testing, around 5,000 tests in Kansas City. The data doesn't flow very well yet. That's part of our unfortunate fragmented federal, state, local data systems that need to be fixed. We don't have all the results of how many have been tested that are negative, but our best guess right now is about 1% of our population has been tested. We've never really tested more than 100 in a day until this surge that we're doing right now, that we got some additional tests the last 2 or 3 days here. We should be testing at about 150 per 100,000 population. So for a 500,000 population in Kansas City, Missouri, that's 750 tests a day, not less than 100 a day. And if we're not doing that level of surveillance, our chances of picking up outbreaks, particularly as you know, this is different than Ebola, where you can see somebody's ill, they don't pass the disease until they're very seriously ill. A lot of people, including right here in this area, probably have the virus now and don't know it, and are potential spreaders of the disease. So unless we do a lot more testing, we can't stop those outbreaks. That's also the reason for the creative issue of creating the logs and the ways. Yes, I am concerned about certain populations that don't have trust, and that may be a problem. And so we've got to work into our requirements that, you know, it is only to be shared with the health department, that it's not going to be something that's available other places, that they keep it for like 30 days and then it's destroyed in regards to that kind of contact list. But that will help us stop an outbreak much more rapidly. One of the other questions that came up, enforcement. So just like with our non-smoking laws, the vast majority of enforcement is done through peers and people understanding that this is needed. So all of our polling that's been done across the nation is that 70, sometimes as much as 80% of the public supports all these types of rules. And in fact, of those that don't just support it, it's almost 50-50 of that that's left that want it even stronger than what we're doing. So we think that a lot of this will be peer pressure. We will have folks that have their eyes and ears out there that will raise complaints, and then we'll go out and work with folks. Sometimes non-compliance is simply you need to motivate and educate people to do the right thing. I like to say to everybody, when in doubt, don't go out. When in doubt, don't go out. And that's particularly for those that are over 60 that have pre-existing conditions. So that, well, let's go around the questions here.
Question for Dr. Archer? No, this side.
I've got a question. What's the threshold for pulling back? So I know we're moving forward right now, but what do you need to see to say this isn't working and pull back?
So to reinstate more difficult requirements?
Yeah.
Well, if we see a surge of increased cases, obviously we'll be monitoring. We monitor daily the med surge and ICU beds in the metro wider area, but also in Kansas City, Missouri. So if we ever predict that we're going to get into trouble there where we might have to ration ventilators or beds, then that would alert us to that. If we start seeing lots of new cases that we can't link to a cluster or where they came from, that's telling us that the positivity rate is even higher. Right now, on those samples that have been done, we had a way unacceptably high 10% positive rate. That means we're not testing near enough. If we're not getting our positive rate down below 1%, we're not testing enough, because that means there are cases out there that we're not picking up and we're not testing enough. So we'll be watching all those parameters. There's actually probably 10 or 15 different kinds of metrics that we have to be looking at. The other thing is, if the federal dollars don't come, we're going to be challenged if we do start having outbreaks, putting those down. If we get outbreaks in several nursing homes and our staff now become overwhelmed at stopping the outbreaks, then we might have to slow things down because we can't manage the outbreaks that are occurring. Other questions?
Any other questions? All right. Thank you all.
Thank you.